Good afternoon. Mr. Baptiste, my name is Teresa, and I'm here with your medications. I was here a few minutes ago, and I told you I'd be coming back. Great, I'm glad you remember. What I'd like to do before I get started is to do my hand hygiene. Do you have any questions at all about your medications? I know these are new. Right, your doctor said that it impacts blood pressure. It sure does. And the other one is to help prevent blood clots. And the other is for the cough that you've been having. Any other questions that you have? All right. So I've entered his room. I've done my hand hygiene. I'm just going to check my list. I'm assuring privacy. Let me identify my patient. Can you state your full name? Francois Baptiste. Indeed. And what's your date of birth? 2/5/1927. Thank you very much. So I've used 2 forms of ID for my patient here. Then can you tell me if you have any allergies? None? Great, that's what we have on record. I explained a little while ago what's about to occur, but being that your tube is new, I'll tell you again. What we'll do is we'll fold down your blankets, I'll lay out a pad, and we're going to administer medications through your tube because you've got some swallowing challenges at this time. Do you have any questions about that? No? Okay. And I'm going to go ahead and put my gloves on. All right, Mr. Baptiste, I'm going to fold your covers down, exposing only as much of you as I need to do this safely. Students, you would use this opportunity to assess the dressing, any incision in the skin, anything going on there. And it looks good. Now I'll take my blue pad. More than one time I've been glad I had my blue pad here because it prevents a complete bed change at times, or it prevents a gown change for the patient, so we want to be sure we have that. You have 2 ports here and you'll receive instruction on that, but you want to be sure you're going into the port with this that doesn't have the balloon port. You want the other port here. Sometimes you'll see 3. We'll explain the differences. This one happens to have a clamp. When you have a patient who has a clamp, that's a bonus. You don't always find a clamp. When there is not a clamp, you can kink the tube by folding it over to prevent backflow while you're taking care of other things that you're doing over here. Now, what I want to do is elevate the bed up just a little bit because I'm finding that I'm straining my back. I want to be careful I don't dump the table. All right, so here we go. What I need to do is to check placement of the tube. I'll place that over skin. I want to draw up air, about 15 milliliters. I want to stick the syringe into the tube. Make sure my clamp is open and listen for air. What I want to do is check residual. So I again need the clamp off. What I'll do is draw back. And I'm hoping that I get very little or no tube feeding or anything else into my syringe. If there is residual, 100 cc's or more, you would hold the medications and notify the physician. However much residual you take out needs to be returned to the patient. Let's say you were to pull out 40 cc's of residual. You would take note of that because you're going to document that, but you then return that to your patient. So you instill that back in. And then clamp your tube. Throughout your procedure, you can ask your patient if they're comfortable. Are you doing okay, Mr. Baptiste? All right. So there's your syringe. Now we take a look at our medications here. We've still got our MAR, but pretty much you've verified that what you're administering is correct. And so there's not a whole lot of back and forth with that at this time. You know you've got the 3 meds that you had on your MAR, You brought your MAR in to verify your patient's identity, so we're pretty much done with that. So now what we need to do is use our syringe like a funnel. You take out the plunger. Oops, this can be messy, so we be careful. And we put it into our patient's tube and then open the clamp. And so it looks like a funnel. First thing we do is we start with about 15 cc's of water. These cups hold 30 cc's of water, so half a cup, right? You come with a couple of these prepared, you pour in 15. And you, oops, you hope that doesn't happen. And it goes through. That's beautiful. Then you begin with your medications. Sometimes the medications can clump, so you want to do your best to get them in solution before instilling them. And sometimes you'll see that a little residue remains in the cup. If you're uncomfortable with that amount of residue and you feel they're not getting their full dose, you can add a little water to that, stir it up again, kind of rinsing the cup as you go, keeping it in solution. Makes me think of a snow globe. You keep all of that floating around while you pour it in. There it goes. And then you always flush in between. You want to use minimal amounts of water, about 15 milliliters, because the patient can get full. If they get full on meds, they won't take food, right? So we flushed the first one through. The second one is about to come through. Let's see how this is looking. We get that in solution. And pour it through. Looks like it's gone through. Good. And I rinse again, 15. And then the cough syrup. Time for that. Nothing to really mix there. Pour that through. It's been successful. I put a little more of this through, about 15 to 30 at this point. Your final flush, you really want to be sure that that's going well. How are you doing, Mr. Baptiste? Great. So I clamp that because if he coughs or something, it could expel some of what just went in. I take my syringe out, put the clamp back on here, put the plug back on, and we're about done. All right, your medications have been administered. I will be back in about a half hour to check on you, make sure things are okay. Let me clean up what I've got going on here. So you'd just make sure you didn't make any type of a mess. You tuck him back in here. Reposition for comfort. Would you like to be a little flatter? Sure, you can do that. Lower the head, oops, I'm sorry. Lower the head of the bed a little bit for comfort. There you go. And warmth. And before I let you go, let me just make sure. All right, he didn't have tube feeding running, so we're not going to resume any tube feeding. He's good in that regard. Now it's time for us to dispose of our equipment, so I can remove my gloves, perform hand hygiene again, dispose of my blue pad, and then we do our typical things. Lower the bed. Oops. And then we make sure that he's comfortable. Leave the call light within reach. Your call light is here at your hand, Mr. Baptiste. If you need anything or if you become uncomfortable, please give us a call and I will be back to check on you. So typically the syringe itself is left in the patient's room at the bedside. They change these per facility policy, so it may be a daily thing. So I would leave this on the nightstand. I would take this other business out with me. Thank you.